to all of you. Today we will discuss about the hemorrhage in early pregnancy. So introduction, the cause of hemorrhage in early pregnancy is divided into two categories. Two etiology. One is those related to pregnancy and second one is those associated with the pregnancy. So etiology, those related to the pregnancy will be abortion. It is 95% ectopic pregnancy, hydrated from mole, implantation bleeding and suborganic bleeding. Etiology associated with the pregnancy can be cervical lesion, vascular atrophy, erosion, cervical polyps, rupture of varicose, and malignancy. These are the two etiology which lead to the hemorrhage in early pregnancy. First, we will discuss hemorrhage in early pregnancy. One etiology was the hemorrhage related to pregnancy. The first etiology was abortion. First, we will discuss about the abortion. So, first discuss about the definition. Abortion is expulsion and extraction from its mothers of an embryo or fetus weighing less than 500 grams or less when it is not capable to independent survival. Approximately 150 days a period of gestation. This definition was given by WHO. Another definition, abortion is a removal of pregnancy tissue product of conception or fetus placenta after death from the uterus. Next definition is abortion is the expulsion of the fetus before it has reached to the stage of viability before 28 weeks of the gestation. So before 20 week of the gestation, pregnancy loss can be counted as a abortion. Definition, abortion is a termination of the pregnancy before the period of 20th week. When we are remove the pregnancy, terminate the pregnancy 20 before 20 weeks of gestation, it is also known as uh, medically termination of the pregnancy. Definition of abort. Abort means the expel embryo and fetus is called abort. Miscarriage. It is also known as the spontaneous abortion. So we are already discussing the abortion, so we should know what is the classification of the abortion. So classification of the abortion will be two types. One is the spontaneous, either we can miscarriage. Second one is the induced by deliberately, for example, medical termination of pregnancy. So spontaneous abortion further divided into two parts. One is the isolated and recurrent, and induced MTP, induced abortion may be divided into two parts. One is the legal abortion, which are doing in legally due to their special cause of the mother as well as in a fetus, that is known as medically termination of the pregnancy. One is the illegal abortion and which lead to the septic abortion. Isolated and recurrent abortion has further classification, that is the threatened abortion, inevitable abortion, complete abortion, incomplete abortion, missed abortion and septic abortion. We will discuss it one by one. First we will discuss about the spontaneous abortion. So definition of the spontaneous abortion is this category includes threatened abortion, inevitable, incomplete, complete, missed abortion. In spontaneous abortion is termination of the gestation before the end of the 28th weeks of the pregnancy. So another definition of abortion, abortion is the expulsion, extraction from its mother of an embryo or fetus weighing less than 500 grams less when it is not capable to independent survival. I have already discussed this definition or before starting this abortion topic of abortion. So in hemorrhage in early pregnancy, but here I also explain again this definition which is given by WHO. 31% pregnancy were lost after implantation. 12% of the early pregnancy in which bleeding occur went go to termination. Cause of the spontaneous abortion. So, etiology of spontaneous abortion can be fetal factors such as the genetic factor, maternal factors such as the endocrine factor, anatomical factor, infection, immunological cause, autoimmune disease, age of the mother, and other factor, lifestyle, etc. These are the cause of spontaneous versions. First, we will discuss about the chromosomal. So, there is a two type of the chromosomal abnormality. One is the euploid and one another is the uniploid. So, in euploid there is a 46XY and 46XX, and aneuploid there is the autosomal trisomy monosomy 45 X. Triploidy, that is a tetraploidy structure abnormality. Endocrine and hormonal factor, low progesterone level in 3 to 4 months. In the corpus luteum, in the ovary continue to secrete the progesterone and estrogen, which maintain the lining of the uterus during the pregnancy. After that, the placenta do this work by itself, providing the nourishment to the fetus. Progesterone and estrogen secrete 8th day after the fertilization. When we are doing the blood test to detect the blood and urine test, we will detect the HCG level in that. Low level of progesterone can cause the miscarriage due to inadequate production of the corpus luteum. If corpus luteum is not working properly, it will not secrete the estrogen and progesterone. So there is a impossible to continue the pregnancy because uterus lining is not maintained by another hormone. So another hormones. So infection, neonatal herpes, cytomegalovirus, chlamydia, mycoplasma, parasitic, toxoplasmosis, and streptococcus infection also lead to the miscarriage. Another cause, immunological cause, we are already discussed this cause earlier, that is the HIV AIDS. Autoimmune disease, that be antibodies, our antibody will not accept the content of the pregnancy anticoagulant, the blood will be coagulated and that will not give the adequate supply to the fetus, and that will lead to the spontaneous abortion. Anticardio dip in antibodies, it will not form the heart of the fetus, and lastly it will lead to the abortion. Erythrocytosis and RBC will be destroyed. Age of the mother, less than 18 and more than 35 years, there is a chance of chromosomal abnormality which will increase the chance of the spontaneous abortion. Next one, another factors, that is the environmental factor and chemical toxin that will also responsible for spontaneous abortion. Health condition of the mother, uncontrolled diabetes mellitus and thyroid lead to abortion and miscarriage. Lifestyle of the mother, excessive use of the alcohol, drug user increase the risk of miscarriage and spontaneous abortion. How to diagnose this spontaneous abortion? It is diagnosed by two types. One is the transvaginal ultrasound. One is the qualitative beta subunit of the human chorionic gonadotropic beta HCG level and pelvic examination. Pregnancy diagnosed with the urine and serum beta HCG test. When we are doing the blood test, in which if the HCG level is less, that will lead to the spontaneous abortion, that show there will be a corpus luteum is not working adequately. Transvaginal ultrasound is the main method used to evaluate the spontaneous abortion. If UG ultrasound is not available, then HCG result may be informative. Transvaginal ultrasound is used for confirm the fetal cardiac activity detect into 5.5 months to the 5.5 week to the 6 week of gestation. At that time, we will detect the cardiac activity of the fetus. Transvaginal diagnosis of the pregnancy is failure if there is a one or more of the following finding. For example, crowning rump length plus minus 7 diameter mm and there is a no heartbeat. Mean sac more than 25 mm and no embryos. Absence of the embryo with a heartbeat after previous scan in current scan. Pregnancy more than 2 week earlier that show a gestational sac without a yolk sac, or more than 11 days earlier in current pregnancy that show a gestational sac with the yolk sac, that if there is a one or more finding that will show the pregnancy will be failure and it will lead to the spontaneous abortion. Clinical feature of the spontaneous abortion. So what is the sign and symptom of the spontaneous abortion? First sign is the pain in the lower abdomen. This manifests cramping. The cramping will be there or contraction as the uterus work to expel the pregnancy with vaginal discharge. So uterus, there will be a contraction, there will be a labor pain type, there will be a cramping, and there will be a vaginal discharge that show the pain in the lower abdomen. Pain area in the abdomen, back and pelvic region. So this pain, the area of the pain will be lower abdomen, back and pelvic region. Pain resemble dysmenorrhea and menstrual. And the type of pain, how we find it, it is like a dysmenorrhea and menstrual pain. Per abdomen examination, uterus feels soft, enlarged, corresponding to the period of amenorrhea or period of gestation. Per speculum examination, the os is closed or can be open. Visualization of the pregnancy tissue or placenta within the cervical opening or producing from the vaginal canal. Stain discharge is present. So by manual examination, the examiner also feel the uterus and the ovary for tenderness, size and the masses which help to differentiate the diagnosis. Lab investigation in spontaneous abortion, blood test show the level of HCG will be lower in spontaneous abortion, which indicate loss of pregnancy. Tissue test, examining the tissue passed during the miscarriage can be give the history of abortion is occurred. So genetic testing, DNA and chromosome protein that lead to the genetic factor, chromosomal abnormality, Down syndrome, trisomy, aneuploidy, loss of individual chromosomes such as the trisomy or monosomy, polyploidy, the presence of the one or more extra complete set of the chromosome will be present. For example, excess, it is a one copy of the extra chromosome will be present. Turner syndrome affect the female with the missing or incomplete chromosome. Blood type, Rh factor, immunoglobulin to prevent the uh, complication of the further pregnancy. Coagulation test and CBC to know the degree of the ongoing bleeding and rule out the clotting disorder DIC. Misoprostol and misoprostol medical management used to expel the remaining pregnancy tissue. Misoprostol, this medication can be given first to block the progesterone maintaining a pregnancy. Misoprostol taken after misoprostine, often 24 to 48 hours, help in uterus contraction and expel the pregnancy tissue. Tablet Brufen can be given for the pain management. Vitamin B complex, iron, calcium also given to the woman. Antibiotic given as per the protocol of the hospitals. Can be given ampicillin or someone can be given amoxicillin. So surgical management of the spontaneous abortion. Surgical management involve the procedure to remove the pregnancy tissue from the uterus. The first procedure is suctioning and curettage, also known as the manual vacuum aspiration, can be performed in a local anesthesia, sedation or general anesthesia when body is not expel the tissue. When pregnancy tissue retained inside can be dead fetus, it can be placenta and its membrane. At that time we will do the suctioning and curettage. This is the surgical management of the spontaneous abortion. Dilatation and curettage, that is known as the DNC. In the cervix is dilated. In this cervix is dilating by using of the shaft metal curettage to scrape the tissue from the uterine wall. So different type of the dilator can be used to dilate the cervix, and after that curettage is used to remove the content of the pregnancy product from the uterus. Nursing management of the spontaneous abortion. Emotional support, reassurance the patient and address the anxiety, fear and knowledge about the spontaneous abortion. Monitor and manage the heavy bleeding. So assessment of the amount blood loss, presence of blood clot, count the number of the pad and soaked in a 1 hour, and also blood tests sent to the laboratory to know the HB level of the patient. Vital monitoring, blood pressure, pulse, respiration and oxygen saturation to detect the sign of shock. So there will be a heavy bleeding and that can lead to the volume deficit and may go to hypovolemic shock. medication, the pain management evaluate the severity of the pain and characteristics of the pain. So you should not wear the pain characteristics mild, moderate and severe, and areas of the pain that can be abdomen, pelvic region and perineal region. So nursing management of the spontaneous abortion, prevention of the infection. So we will prevent the infection when some product retain inside the uterus that will lead to the infection. For example, retained bites of the placenta membrane, and some clots are retained inside the uterus that will lead to the infection. If we are not doing the proper perineal hygiene, we will not uh, use the sterilized article during the procedure of the abortion, that will lead to the infection. So adequate perineal hygiene should be maintained and retained product of the pregnancy should be removed. Fluid management, the patient may go into hypovolemic shock if there is a lot of heavy blood loss. So you should give the volume expander. For example, we can give the Hemexil and we can give the intravenous Normosaline. Health education related to self-care, personal hygiene, perineal hygiene, body, baby care, breastfeeding, diet, immunization, follow-up and family planning. These are the areas which we will give the health education to the mother. So lastly, I will discuss about the nursing diagnose which are formed in which will be make in a spontaneous abortion. That's the first diagnosis: risk of the fluid volume deficit related to the excessive blood loss secondary to the disease condition, secondary to the we can say the spontaneous abortion. So how we will maintain the fluid volume? We will give the some fluid to the mother, that is volume expander till the blood will be arranged. After that we will give the blood transfusion to the mother, that so that the risk of fluid volume deficit can be improved. Anxiety, fear related to the heavy bleeding secondary to the disease condition. Yeah, we can say the secondary to the spontaneous abortion. So we will remove the anxiety and the fear. So we will reassurance the mother. We will assess the vital of the mother. We can say, yeah, your general condition is improved as early as possible. Knowledge deficit related to surgical procedure and complications secondary to disease. We give the health education and all information to the mother regarding the surgical procedure, why we are doing the surgical procedure, what is the importance of the surgical procedure, what complication can be occurs after surgical procedure, and what is the benefit of that surgical procedure in a spontaneous abortion. So lastly, thank you for listening. Thank you to all of you for listening.